Yes, Shiva, we can start now. We are live.
Welcome one and all to the Epignosis national level radiology quiz. First of all, I would like to thank Dr. Kishan Rao for creating this amazing opportunity to all of us and medicos all over the nation and consistently conducting such quizzes from the past few years. So thank you so much, sir. And I will be hosting you along with the quiz master, Dr. S.M. Tejas, who has put in a lot of efforts to make this possible for the past few days. So thank you so much, Dr. Tejas, and welcome to the quiz.
Thank you.
Let me take the privilege to introduce our finalists who have fought out very hard-fought prelims to make it into the finals. Our first finalist is Mr. Karthikeyan AG. He's a fourth-year MBBS student from Madras Medical College. Congratulations and welcome to the finals. Our second finalist is Dr. Sayani Purel. She's a intern from Calcutta National Medical College, a familiar face to Epignosis finals. Welcome and congratulations. Next is third finalist is Dr. Sayantan Basu, who's an intern at Medical College, Kolkata. Congratulations, doctor, and welcome to the finals. Our fourth finalist is Dr. Srinada Das, intern at Medical College, Kolkata. Welcome, doctor, and congratulations. Last finalist is Dr. Akshay Rao, who is an intern at Mysore Medical College. And congratulations, Dr. Akshay, and welcome to the finals. We have privileged participants, Dr. Kriti Priya, who is an MBBS intern at Srinivasa Medical College, again a familiar face for Epignosis finals. Welcome and congratulations, doctor. Thank you for being here today. So I would like to thank all of the finalists again for being here for the finals and all the very best. Fight it out fair and square, and I'm 100% sure that Dr. Tejas has very interesting questions in his bag. So over to you, Dr. Tejas, and all the very best. Thank you so much, and thank you so much, Dr. Kishan.
Thank you, Dr. Shiva, for that wonderful introduction. Firstly, I would like to thank Dr. Kishan sir for giving us an opportunity to make this quiz, and this is a part of learning for me also. Before starting, this quiz directly, I would like to talk about the importance of radiology, not just for our exams, but also for our day-to-day practice of medicine. Firstly, I'll talk about the exam view. I think radiology at least has some 30 questions in any exam, give or take. And most of the questions are clinically related. No questions are directly asked in radiology. And coming to day-to-day practice, I think nowadays any disease, taking from the simple fever to a complicated neoplasm, any disease needs radiological investigations. So I think correlating radiology with the clinical side is extremely important. So I've made this quiz as clinical as possible. So sit back and have fun. Like Kishan sir always tells us, this quiz is not about winning or losing or competing. It's more about learning and having fun. Okay, let's all learn through next 1 hour. Let's learn some radiology. So without further ado, let's quickly jump into the round one. Well, the round one is called as Basic Instinct. I think we all have watched this movie. So the significance of this round is that a radiological image will be shown to you. So what is the first thing that comes to your mind, or what do you think is a radiological image? Is the answer that you are going to give. So there are two parts of this round. If you can answer the question without the help of the clues or clinical scenarios, then you are going to be awarded 10 points. You can also use clinical scenarios or clues, which is going to award you 5 points. There are no negatives in the round, so take your chances. There is always a bonus question along with the main question, which is going to award you 10 points. The bonus question can be answered only if the main question is answered. And passing is there, but just for the bonus question. So without further ado, we'll start with our first participant, Mr. Karthikeyan. Are you ready, Mr. Karthikeyan?
Yes, sir.
Okay, so you understood the rules, right? No doubts in the rules?
So if I want to answer for the first without the clue, and if I have to say that I need the next clue, then only you will say the
yeah.
next
So
clue.
every question, every radiological image will be associated with a clue or a clinical scenario, which can be opened only if you will for it. So if you answer it without the clue or clinical scenario, you're going to get 10 points. If you answer it with the clue or the clinical scenario, you're going to get 5 points. Cool?
Yeah, okay, fine.
Okay, so here's your first question. You get 45 seconds to answer the question, okay? With or without the clues. Total 45 seconds. Here you go. Identify the following pathology.
This is
Okay.
ice cream cone sign,
Okay.
acoustic neuroma.
Okay, very awesome, very awesome. You're right. So this was the clinical scenario. Would you like to make a comment on the clinical scenario given, especially about the ear findings? Would you like to make a comment on the Rinne's test positive in both ears and Weber's test lateralized to left ear? Can you comment on it?
So this is a sensory neural hearing loss.
Okay.
So because Weber is being lateralized to the left ear, it is on the right side. Acoustic
Yeah.
neuroma is on the right side.
Right. So if it is a conductive hearing loss, then Weber's will be lateralized to the same ear. But if it's a sensory neural hearing loss, the Weber's will be lateralized to the normal or the opposite ear. So here is your bonus question, Karthikeyan. What is Heiselberger sign?
Yeah, Hitzelberger sign is hypoesthesia in the posterior meatal wall of the ear due to involvement of the facial nerve. Facial nerve is a branch. So in acoustic neuroma, there is hypoesthesia of the posterior wall of external auditory canal. This is called Hitzelberger sign.
Okay, wonderful. You're completely right. Can you just give me a idea where the compression of seventh nerve will happen? Like which part of the anatomical part will the
In the internal auditory meatus, the Bill's bar divides it, right? When the eighth nerve and the seventh nerve enters through it. So I think that's where the compression happens.
Yeah, wonderful. So in the internal acoustic meatus is the place where there will be eighth nerve, two divisions of eighth nerve, cochlear and vestibular, and seventh nerve will be there. So that is the place where it is going to get compressed. So wonderful, you are completely right. So you get awarded a whooping score of 20 points, the main question 10 points and the bonus question 10 points. So one small question for the privileged participant, Dr. Kriti, are you there?
Yes, sir.
So can you please name me any syndrome which is commonly associated with acoustic neuroma, like very commonly seen syndrome, which is very
Neurofibromatosis type 2.
okay.
Bilateral acoustic neuroma.
Which type is bilateral?
Type 2, sir.
Yeah, wonderful. So type 2 neurofibromatosis is associated with bilateral acoustic neuroma, and neurofibromatosis type 1 is associated with unilateral. So wonderful. So all questions were whoopingly answered with no time. So let's go to our second contestant, Dr. Sayani. Are you ready?
Yes, sir.
So you understood the rules, right? So once the question is put, you get 45 seconds in total. Okay. So here's your question, Dr. Sayani. Identify the renal pathology involved.
Is it,
Uh,
is it
last
renal angiomyolipoma?
Can I confirm the answer? Once I confirm the answer, you can't change it.
No, I will see the options. Means
Okay.
renal
You have 20 seconds left. It is the most common benign tumor of kidney and the kidney.
oncocytoma. Renal oncocytoma.
Okay, wonderful, wonderful, Dr. Saini. So you get score of 5 points for answering this question with clue. Can you speak why did you what made you feel it's renal oncocytoma so fast?
Because of the central stellate scar.
Yeah, so you can see the central stellate scar here. Okay,
Yes.
so this was a renal oncocytoma on left side. Any comments on the kidney specimen given?
Sir, it's a gross yellow specimen. Gross
Yeah.
yellow, tan
Uh,
yellow. And at the center, we can see the scar.
Yeah, so it is characteristically called as mahogany tan appearance.
Yes, tan brown.
Yeah. So the bonus question is as follows. Name two diseases with similar feature on radiological imaging, Dr. Sani. You get last 10 seconds are remaining through your question, so you just get 10 seconds.
Fibrolamellar hepatocellular carcinoma.
No, that's wrong. So your bonus question will be passed to Dr. Sayantan. Dr. Sayantan, are you there? Would you like
Yes.
to? Yeah. Can you name 2 diseases with similar features of radiological imaging?
Chromophobe RCC and focal nodular hyperplasia.
Yeah, wonderful. So you get 10 points for answering this. So you're right. So the central stellate scar, it is seen in 3 places mainly. One is in renal 2 diseases. One is renal oncocytoma and one more is chromophobe RCC. And in liver, you see it in focal nodular hyperplasia. I think you got confused with focal nodular hyperplasia and fibromedular variant
sir,
of
yes.
XC. Yeah, I know, you got it. It's okay, Sani, you can always redeem the score in the future rounds. So, Dr. Sayantan, are you ready for your question?
Yes.
Okay, so once the question is put, you get 45 seconds, okay?
Okay.
Okay, cool. So, identify the lung pathology. Remember, need the specific pathology.
Clinical question.
Okay, cool. So 88-year-old male came to OPD with new onset exaggerated difficulty breathing since 3 days. He is known case of congestive heart failure since 5 years and is on medications. He was admitted and was put on diuretic treatment, and follow-up chest X-ray is done 1 day later. Intern who was working there finds out that the follow-up X-ray is normal and pathology is not seen and was astonished 1 day later.
It's a phantom lung tumor.
Yeah, what? Okay, wonderful. So what is, can you give me other name of phantom lung tumor?
A vanishing tumor or phantom.
Yeah, very nice. There's one common name, very commonly used name. It's okay, you got points for this, just asking. It's called loculated pleural effusion, very important. So this is loculated pleural effusion. So this, like in the question, so what will happen is once the this especially happens in congestive cardiac failure patients. So once the treatment is started, this loculated pleural effusion will vanish immediately. So only this is called as phantom lung tumor or vanishing lung tumor or loculated pleural effusion. So, Santhan, your bonus question is ready. Are you ready to answer? You are left with 15 seconds of time from your main
Yes,
question.
yes.
Okay. Yeah. What is the criteria used to differentiate between the
Lights
exudative?
criteria.
Can you tell me what light criteria is?
LDH of the pleural fluid by plasma more than 0.6, sugar of plasma by pleural fluid of plasma 0.5, and upper limit of LDH more than 2/3 of the plasma.
Okay, LDH you told one more, right? You told sugar.
Sorry, so protein, not sugar.
I'm sorry, Dr. Santhan, your answer is considered as sugar. So I'm sorry I can't give you points, but would you like to reiterate the answer? One thing you told is already LDH, but protein, can you please tell?
Protein.
So protein will be less than 0.5 in transudative type, then protein will be more than 0.5 in exudative type. You got confused with sugar, I think. It's okay, it happens. Again, like I told you, can redeem in your next
No,
further round.
Tejas, no, you can give him the marks. Okay, please be lenient. That's okay.
Oh, okay, sir. Yes, sir. So, okay, Dr. Santhan. So for this, you're going to get a total of 20 points. Moving 20 points, one is for answering the bonus question and answering the main question. So the next question, Dr. Srinada, are you ready?
Yes, sir.
Okay, so here is your question, Dr. Srinada. This is a first trimester scan of a 28-year-old multigravida patient. Give your interpretation. Again, need a specific diagnosis. Once you confirm the answer, need the specific type of the pathology seen.
So this is a complete hydatidity for mole.
Okay, wonderful. So yeah, the clinical feature was like pregnant female counts with passing of grape-like vesicles, bleeding per vaginally at 8th week of gestation, and history of similar complaints, abortion, and had an abortion in a previous pregnancy. So complete hydatidifform mole is the right answer. So you have a lot of time left for your bonus question. So would you like to take a try at your bonus question?
Yes, sir.
Yeah. So here's your bonus question.
So the three differences are, firstly, in a complete hydatidiform mole, there is no fetal tissue, whereas in a partial hydatidiform mole, fetal tissue is present.
Wonderful.
So, complete hydatidiform mole, or the height of the uterus is always more than the period of gestation. In a partial mole, it may be same as or even less than the period of gestation.
Wonderful.
And complete hydatidiform mole, the karyotype is
You're almost there.
complete hydatidiform mole is formed by the fusion of one ovum with a sperm and then duplication, whereas in the partial mole,
It's okay, Dr. Shinara. You almost tried it, so you'll get a score, complete score. One small change in the answer was, like you told, so the complete mole doesn't have any maternal genes. It is only the
yes,
paternal, only the sperms which form the mole.
yes,
Only there are no fetal parts. But in partial mole, it is usually 69XXY or 69XXX. So it is one ovum and two sperms which is forming. So fetal parts might be formed little bit. And other important clinically how to differentiate our molar complete mole. Complete mole will have a theca lutein cyst on radiography. That won't be present in partial mole. So you answered your bonus question and the main question right. So 20 points to you. Congratulations. And our last question for our round one. Dr. Akshay, are you ready? Dr. Akshay, are you there? Hello. Dr. Shiva, can you please check if Dr. Akshay is there in the meeting?
Akshay is there, he's muted. Akshay, unmute yourself.
Dr. Akshay?
Hello, sir. Yeah, am I audible?
Yeah, you're audible, Dr. Akshay. So, are you ready for your question, Dr. Akshay?
Yes, sir.
Okay, the question goes like this. You have 45 seconds. Kindly give your interpretation of a preterm neonate erect X-ray abdomen and give your diagnosis of the pathology.
So is it necrotizing enterocolitis?
Okay, wonderful. Do you want to name the findings seen here?
Sir, there's like there are air shadows that are seen around the bowel, sir.
Okay, wonderful. So here's your, this was the clinical features. So let's come back to this. Do you want to answer your bonus question? What is the staging used for necrotizing enterocolitis?
Sir, it is a modified Bell staging is used.
Okay. Do you want to tell what is modified Bell staging?
Sir, I'm not perfectly sure. There is stage 1, 2, 3, and 2 is once again A and B is there, and 3 also A and B is there. Division.
So it is a total of 10 points. You had to tell me the staging also, but like because you told me the name of the staging, I'm going to give you a 5 points, okay, for a bonus question. Dr. Kriti Priya.
No.
Do you want to try?
No, I can continue.
Yeah. Give it a try.
Most commonly used staging is modified Bell staging. Stage 1, there is just diarrhea-like symptoms can be seen. Stage 1 and 2, there is pneumatosis, pneumatosis intestinalis is seen.
Okay.
2B. And pneumatosis portalis is also seen in the third stage with this.
There is little changes that you need to be done in that. Let's ask Dr. Kriti Priya. Dr. Kriti Priya, do you want to take a try at this? Our privileged participant, Dr. Kriti. Do you want to tell us what is Bell staging? Do you want to try?
Sir, I think type 3 is pneumatosis intestinalis.
I want it from type 1. What is type 1? Type 1A, 1B, 2A, 2B, 3B.
I don't remember, sir.
It's okay. Anyone who wants to give it a try?
Type 1 will have one is that abdominal distension, occult blood loss. Those are type 1. Okay. And type 2A will have hematochezia and bowel sounds will be absent in type 2A.
Okay.
And type 2A, in both type 1 and type 2A, apnea, bradycardia, temperature instability, all those will be seen. When we
But
come to
this
stage
is not
2B,
included in Mr. Karthikeyan. I'm sorry to interrupt you. What you told is completely right, but it is not included in Bell staging. Is what is my point.
okay.
Yeah, anyone who knows point to point of Bell staging, because it's, again, I think it's very important for us. So here it goes, like our Mr. Karthikeyan told, stage 1, there is again divided into 1A and 1B. So 1A will be non-specific symptoms like abdominal distension, but there won't be any occult blood loss in 1A. 1B will have occult blood loss. 2 is the one where there is gas shadow in the abdomen. So 2A will be pneumatosis intestinalis, like it is seen in this. This is going to be our 2A stage. And 2B is called as pneumatosis portalis, like someone told already. 2B will be pneumatosis portalis, where air shadow will be there in our portal vessels. And 3 is when our peritoneum is involved. So 3A will be features of peritonitis. So there will be ascites and abdominal distension increased and abdominal tenderness. And 3B will be last stage, that is pneumoperitoneum. And like our Karthikeyan told, there is very, very important triad of necrotizing enterocolitis, which we usually don't remember because it is not related, which is hyponatremia, metabolic acidosis, and thrombocytopenia. Very important triad of NEC, necrotizing enterocolitis. And one more important thing which this clinical scenario leads us to necrotizing enterocolitis is the preterm baby. Necrotizing enterocolitis is very, very common in preterm baby, and especially preterm babies who are fed with anything other than breast milk, cow milk. Okay, so the round 1 is done. So Akshay, Dr. Akshay, you get 15 points for this round. So at the end of round 1, so the scores are like this. Dr. Karthikeyan has got 20 points. Mr. Karthikeyan has got 20 points. Dr. Sayani has scored 5 points. And Dr. Sayanthan has scored 30 points. Dr. Shinada has scored 20 points. And Dr. Akshay has scored 15 points. So participants, I would like to just request you to keep your scores individual, your own scores as well, just in case if there's any discrepancy in the end. Okay. So this is the end of round 1. So without further ado, let's go to round 2. So round 2 is going to be a little more interesting, I hope. So this round 2, you must choose, but choose wisely. So this is also an MCQ round, okay? So there is going to be one clinical scenario given, and there will be a clinical scenario will be given, and 4 options will be given. You have to choose the right options, okay? So each question will carry a score of 10 points. So what is challenging and negative included mean is, so if you answer a right question, 10 points will be added. If you answer the wrong question, subtraction of 5 points will happen. So what is challenging is, to make this interesting, what I've done is, so the first contestant, if he chooses an option, the next contestant, the immediate contestant, can challenge the option that is being answered by the first contestant. Whoever is wrong, from them the 5 points will be decreased. So without further ado, can we start with Mr. Karthikeyan? Are you ready, Mr. Karthikeyan?
Yeah, fine.
Did you understand the rules?
Basically, I have to answer a question.
Yeah, yeah, that is every round. So specifically talking about this round is, suppose you pick option B and your next contestant, Dr. Sayani, feels it's option A. She challenges your option. Then if she is right, she chooses option C. And if it's option C and option B is wrong, 5 points will be negated from you and 10 points will be given to Dr. Sayani. You understood?
Yeah, yes.
And other way around, if Dr. Sayani is wrong after the challenge, then her negative will be taken from her. Okay.
So the person who can challenge is the one just
only
just
one
to the
person,
next office.
Yeah, only one person next can challenge the question. Okay.
Okay.
So without further ado, we'll start. We'll have 45 seconds on the clock. So here's your question. A 35-year-old patient who is a known case of tuberous sclerosis was brought to casualty with unconsciousness. On checking vitals, BP was noted to be 62 by 42 millimeter mercury. On taking history, it was noted that the patient was complaining of pain and mass felt in the flank since 1 day. Find the appropriate radiological investigation of the patient. So time starts now from here. Okay. So there are 4 radiological images here. You need to pick which might be the radiological image of the patient. So A, B, C, D goes in the clockwise direction. Sorry, the options are not mentioned. You can also tell me right top corner, left top corner, right bottom, left bottom also. If you want to have a view at the clinical scenario again, I can put it for you.
Yeah, can you show the clinical scenario again? There is flank pain, right?
Yeah.
Can you come to the next page?
Yeah. Now 25 seconds left. If you don't want to answer, you can skip the question as well. No negative will be marked.
Okay, I'll go with option. I'll go with option A. So if somebody challenges me, it will be -5 for me, right?
Yeah, if it's wrong for you.
Okay.
So you have
I'll
taken
go with
option A.
yeah.
So the
Option
left,
A, which is the top left.
yeah, top left. So Dr. Sayani, would you like to challenge this option of option A? Do you think it's anything else? Dr. Sayani?
Sir, means if I think the same answer, can I say the same thing?
No, if it's the same answer, there's no challenging, right? Do you want to challenge any other option? Do you think it's any other option? Do you want to take a chance? I'll give you 10 seconds to decide. Okay. Okay. So, Dr. Karthikeyan, can you please tell me why you think it's option A?
Yeah, because this has to be a renal angiomyolipoma.
Why do you think it's renal angiomyolipoma?
Because it is tuberous sclerosis and it is associated with it. Yeah, but there is flank pain also, and there is hypotension right now.
Okay.
So in the next image, I wanted to see different focal, different densities. There should be heterogeneous kidney because there is muscle and lipoma, and there is kidney parenchyma as well. So option A fit better. So sorry.
Wonderful, wonderful. So I have one question for you. Are completely right, Mr. Karthikeyan. I have one question for Dr. Krutipriya. Dr. Krutipriya, do you know what is Wunderlich syndrome mean?
Sir, there's the hemorrhage associated with the angiomyolipoma, hypotension.
Yeah, that's awesome. That's completely right. That's correct, Dr. Kritipriya. So, Wunderlich syndrome, this is a case of Wunderlich syndrome. So, Wunderlich syndrome is when retroperitoneal hemorrhage is associated with our renal angiomyolipoma. So, we have something called Lenz triad. So, anyone wants to tell me what is Lenz triad? Anyone? So, Wunderlich syndrome is associated with Lenz triad, which is actually in the question. So anyone wants to try? So basically Lenz triad means it is hypotension. Here the patient has hypotension. There is mass and pain felt in the flank. So the triad is pain in the flank, mass in the flank, and hypotension. So it's completely right. So before going further, so Karthikeyan, do you want to tell what are the other radiological images given here? Quickly.
I think the second one, the top right one is xanthogranulomatosis, emphysematous cholecystitis. There is air in gallbladder, I guess. The top right.
Do you see something wrong with the kidney?
Oh, horseshoe kidney, fine. Yeah, this is horseshoe kidney. Kidneys are connected.
No.
Oh,
No, Mr. Can you see something here, middle? See, horseshoe kidney, there'll be clear connection, okay? These are vessels. See, this is, I think, intestine, huh? Because of that, there is air. So this again, central stellate scar in option B, which is again will be our chromophobe RCC. And in again, third is also our renal oncocytoma with the same central stellate scar. And our fourth option will be our RCC, which is usually a very aggressive type, which is locally aggressive. So the type is not mentioned, so we can tell it is Bosniak type 5 or type 4, I think, yeah. So you're right. So Karthikeyan, you'll get a score of 10 points. There is no negative. Dr. Sayani, are you ready for your question?
Yes, sir.
Okay, so your question goes like this. A 28-year-old female came to the OPD with a rash on her face. Sorry, the rash photo is not given, it's a butterfly rash On examination of her eyes, she is found to have a conjunctival granulomas. She also has tender and erythematous swelling on both of her legs over the shin. She is tested positive for HLA-DR-B103. Find the appropriate lung radiology of the patient. There is a clue given. Deceased patient is in stage 1 of the scoring system used to stage the disease based on chest X-ray. So are you ready to see your options? Once you see your options, your time will start.
Yes, sir.
Okay, so options are like these. So your time has started. You're 45 seconds on the clock. You have last 20 seconds, Dr. Sayani. You can skip it if you want. If you don't want to answer the question, it will pass to the next
Sir,
person.
if I answer it wrong, how much negative?
5 marks, 5 points.
Sir, stage 1. Sir, now option C.
Option C. So left bottom, is it?
Yes.
Okay. So does Dr. Sayanthan want to challenge it?
No, it's correct.
Okay. So Dr. Sayani, can you please tell me why do you think it's what do you think is the diagnosis first of all?
Sir, first of all, this is sarcoidosis.
Why do you think it's sarcoidosis?
Because of the history and that rash, that erythematous erythema nodosum on the legs of the shin, and then stage 1 of the scoring system, the SCADing criteria.
Very good.
Then stage 1 means that the hilar lymph nodes will be enlarged. There will be hilar lymphadenopathy, and only the option C is showing that hilar lymph nodes are enlarged. None of the options are matched.
Okay. So do you want to tell what is, okay, let's ask Dr. Kritipriya. Dr. Kritipriya, do you want to tell what is SCADing scoring system? You want to know?
Sir, it is used in radiological staging of sarcoidosis. Stage 1 is Garland-Stein. Stage 2 is hilar lymphadenopathy with interstitial fibrosis. Stage 3 is complete interstitial fibrosis.
You're partially right. So stage 1, like you told, is only hilar lymphadenopathy and lung parenchyma will be normal. Stage 2 will be hilar lymphadenopathy and lung parenchyma both are involved. And stage 3, surprisingly, hilar lymphadenopathy will vanish. Only lung parenchymal involvement will be there. And it's not fibrosis as such. There will be patchy infiltrations. And in stage 4 is when fibrosis is seen. And very, very important one thing about hilar lymphadenopathy is that, like you already told, Garland sign is seen. So there's one more thing called as lambda sign, which is seen on gallium scan. So it is because of involvement of pretracheal lymph nodes on right side and right and left paratracheal lymph node involvement. So Dr. Sayani, would you like to tell what are the other options? Like what might be the diagnosis of other options? Hello, Dr. Sayani?
Sir, I'm not sure about it. Like this, the second one looks like that there is some. This looks like the first one looks like some consolidation, but yeah, I'm not sure. And this one looks like fibrosis, the fourth one.
Okay. So basically, the first one is it can be most probably a lung carcinoma.
Yes, some kind of consolidation, opacity is there.
Okay, so consolidation, no, because consolidation will be proper lobar involvement. Here it's not a lobar involvement. So probably some lung carcinoma. The second one is second and third one are both are infective pathologies. So Dr. Sayantha, sorry?
Is the second one that bulging fissure sign?
What? No. Bulging fissure sign will come later in this, so we'll talk about that time. So let's go to the next question. Let's not talk about bulging fissure sign yet. So let's go to the next question. Dr. Sayani, you get 10 points for this. Dr. Sayanthan, are you ready for your question?
Yes.
Yeah. So a young male was brought to casualty with symptoms of rapidly painful diminution of vision since 1 week. The consultant takes a class regarding the patient to the students and he tells that McDonald's criteria is used to diagnose the patient. Find the appropriate radiological imaging of the brain of the patient. Are you ready to see?
Yes.
Yeah.
Option A.
Okay. Why do you think it's option A?
McDonald's criteria.
One second. Sorry, my bad. Dr. Shinada, would you want to challenge this option that is being picked by Dr.
No, sir, this is correct.
Okay. Dr. Santhan, you can go ahead and explain why do you think it's option A?
Multiple sclerosis associated with optic neuritis, so there is rapid, painful diminution of vision, and McDonald's criteria used for multiple sclerosis, and radiological imaging is showing Dawson fingers, which are characteristic of multiple sclerosis.
Okay, awesome. So, Dr. Krutripriya, do you want to comment on the other radiological images given here?
Yes, sir. Option 2 is anal cavity malformation. Yes, sir, anal cavity malformation. Option 3 is subependymal nodules. This tuberous sclerosis.
Okay,
Option D is dural tail sign is seen, so probably meningioma.
Okay, wonderful. So, Dr. Santhan, you get 10 points for this question. Dr. Srinada, are you ready for your question?
Yes, sir.
Okay, so here's your question. A 48-year-old chronic smoker since 20 years, 40 pack years, came to OPD with symptoms of pain and numbness in the right upper limb, which wakes her up from sleep since 2 months, which is gradually worsening. She also has complaints of pain in her right shoulder, which radiates to back. He tells that recently she has been having drooping of her right upper lid and has had worsening of her vision and not able to see clearly in spite of wearing glasses. Pulmonary function tests done were normal. Find the appropriate radiological imaging of the chest. So, are you ready to see your options?
Yes, sir.
Yeah. So here's the options. Your time starts. You have last 20 seconds left.
Sir, the fourth option.
Fourth
the
is
right lowermost.
Okay.
The right lowermost option, fourth option.
Okay, Dr. Akshay, would you like to take a challenge on this question? Dr. Akshay. Dr. Akshay? Okay, Dr. Akshay is not.
Hello.
Yeah.
Sir, yeah, it's showing that I'm unable to
wait.
mute without the host permission.
Okay.
That's why I'm unable to unmute every time.
Okay. Dr. Shiva, can you please look into it?
No.
Sir,
you can't keep exiting Dr. Akshay. Okay, every time I have to make you co-host. Okay.
Yes, sir.
Okay, Dr. Akshay, do you want to challenge the option?
No, sir.
Okay. So, Dr. Srinada, why do you think it's last option?
Tejas, she's Srinanda, not Srinada. Okay.
Oh, sorry, Srinanda? Okay. Dr. Srinanda.
Nice name.
Yeah, sorry. My apologies.
I think there is a typo in that finalist list.
You are muted.
Dr. Srinanda, do you want to tell why it is? Yeah.
Yes, sir. So the diagnosis is Pankos tumor. Okay. So there will be a consolidation involving the apex of the lung.
Okay.
And because Horner syndrome features were mentioned earlier, she's also a chronic smoker. So all of this point to the Pankos tumor.
Okay. Do you want to tell about the other radiological images as well?
Yes, sir. For the first image, so I'm not sure about the other images.
Okay. What about the second image? Anyone can tell about the second image?
Cervical rib.
Okay. Dr. Santhan, do you want to tell me why it is not option B but option D? Like, why is it not cervical rib but Pankos tumor? Like, why is it not second? Even cervical rib
Vessels
also.
are not occluded. The symptoms of vessel occlusion is not seen.
But no occlusion is seen, right?
But also the history, chronic smoker and gradual
Yes.
onset.
There's one very, very obvious thing about this question and these radiological images, that it makes it 100% not option 2.
Yeah,
Or any other option.
bilateral breast shadows is seen in fourth image.
Yeah, exactly.
It's a
So
female.
this, so in the question it was mentioned female. So even if you didn't know any answer, any other things about this, I think you could have answered it is option 4, just by seeing the breast shadow. So it's Dr. Shinanda, you get 10 points. The last question of this round, Dr. Akshay, are you ready for your question?
Yes, sir.
Yeah, so your question goes like this. A 68-year-old female came to OPD with symptoms of weight loss and lump in the abdomen. On further investigations, it was noted that she was positive for hepatitis B and had been suffering from hypercholesterolemia. Her alpha fetoprotein levels were 525 nanogram per ml. She has no jaundice or pain abdomen. And find the appropriate radiological investigation involved. Are you ready?
Yes, sir.
You have 15 seconds left.
Sir, I would go with option A.
A.
Left top.
Okay. Mr. Karthikeyan, would you like to challenge his option?
No, not challenging.
Okay. So, do you want to tell me why, Dr. Akshay, you think it's option A?
Sir, I think it's hepatocellular carcinoma. And in hepatocellular carcinoma, we do triple contrast CT is done, wherein there is a arterial and this one venous washout with delayed capsular enhancement is seen. So I think that is what is depicted in option A.
Okay. So my main question to Dr. Kriti Priya, are you there?
Yes, sir.
So Dr. Kriti Priya, can you please tell me why this is like you can use radiological image also? Like, can you please differentiate between hepatocellular carcinoma and liver metastasis to me? Like,
Sir, liver metastasis will be multiple and like it will be enhancing, sir, the nodules in the metastasis of hepatocellular carcinoma.
Not exactly. So CT difference, can anyone tell me the CT scan difference between hepatocellular carcinoma and liver metastasis? Anyone?
Hypodense versus hyperdense lesions.
Where is it hyperdense lesion seen? Where is hypodense lesion seen?
Metastasis as hypodense lesions.
Hypo.
From colonic mets will.
Which phase of CT are we talking about? Can you be more specific? Because we do a triple phase CT.
It's in the washout phase, like where it goes out, the contrast.
So basically, the main difference why we do triple phase CT for hepatocellular carcinoma will be because hyperdense lesion will be seen in the arterial phase of triple phase CT. But in liver metastasis, it will be hypodense in all three phases. That is non-contrast phase, arterial phase, and venous washout phase. All three phases will be hypodense. There's one more difference, which is I don't think it's important for exams, but clinically it's important. You could have just picked that it is hepatocellular carcinoma and not liver metastasis by looking at the alpha fetoproteins. Just remember that more than 425 to 450 is never seen in any other disease, but most commonly in hepatocellular carcinoma. It's exceeding more than 420 or 450. 420 to 450. It is most likely and almost always it is going to be hepatocellular carcinoma. So this round, everyone has scored a whopping score of 10 points. So at the end of this round, the score is going to be Karthikeyan has 30 points, Dr. Sayani has 15 points, Dr. Sayanthan has 40 points, Dr. Shinanda has 30 points, Dr. Akshay has 25 points. So without further ado, let's move to our third round. So third round is called Hum Saath Saath Hain. So basically, we have to find the connecting link between the options given. Each correct answer will fetch us 10 points. Each wrong answer will fetch us 5 points, and there's no pass. To just give an example of how this round is done, I've made one recreational question. It just to lighten up the mood. So can anyone give me a connecting link between these photos? Dr. Kishan sir or Dr. Shiva Prasad, you can also give it a try.
So, Olympic gold medalist for India, Neeraj
Yeah.
Chopra and Bindra in
Yeah.
shooting and hockey team in India.
Yeah, you're too smart for this, Dr. Shiv Prasad. So that's right. So all of these people were gold medalists. So I think you got an idea of how this round goes. So I would like to start this round with Dr. Sayani. Are you ready for your question, Dr. Sayani? I'll
Yes,
jumble
sir.
this round up a bit. So Dr. Sayani, here's your first question. You get 30 seconds for these questions, okay? Positive if you answer, negative once you whatever answer you tell, I'll lock it. So be careful before giving an answer, okay?
Okay.
Tell me a connecting link between these three photos. Your time has lost 5 seconds. The time is up, Dr. Sayani. So, like I told, there's no pass questions for this. There's no pass for this. So, Dr. Kriti Priya, first I'll go to you. Do you want to take a try at this?
Sir,
Can you? Yeah.
rim enhancing lesions is what I can see in the first image.
No, I need a connecting link between these three radiological images. That's all I need.
No, sir.
Anyone else want to would you like to give it a try? Any other participant?
Tuberculosis.
Who was this? Karthikeyan. Why do you think it's tuberculosis?
First one is tuberculoma. Second one is ileocecal TB, that pulled up cecum and that string sign.
Yeah. Third one?
And the third one only I'm trying to devise what it is. I think it is something in ENT TB. I'm not sure about TB. Third one. The overall it must be TB.
Pot
Yeah.
spine.
No. This will be a retropharyngeal abscess because of pot spine. That's correct.
Okay.
Yeah, retropharyngeal abscess. So again, one of the most leading causes of retropharyngeal abscess in India, especially, the most leading cause will be TB in adults. So this is like Mr. Karthikeyan told, the connecting link between these three were TB, tuberculosis. So Dr. Sayani, you didn't get any you didn't answer the question. So you're not going to get any positive or negative. So it'll be just 0. So the next question will go to Dr. Sayanthan. Are you ready?
Yes.
Dr. Yeah. So 30 seconds on the clock. Time starts now. Last 10 seconds, Dr. Sayanthan. Dr. Sayanthan, your time is up. So again, this question will be passed to our Dr. Kriti, privileged participant. Do you want to take a try at this?
Sir, cysticercosis.
No. I want the connecting link between these three photos, radiological image. Not just one radio. I don't want you to diagnose anything. Just give me a connecting link. Anyone can try.
Echinococcus granulosis.
Which is Echinococcus granulosis? Which
All the
one?
parasitic infections.
Hydatitis.
Yeah, that is right. All three are parasitic infections.
Hydatitis, neurocysticercosis, and maybe that's clonorchis or ascaris.
No, that is simple amoebic liver abscess.
Oh.
So basically, amoebic liver abscess and pyogenic liver abscess. Can anyone tell me how do you differentiate it? Like, because this could be pyogenic or amoebic, right? Like, can anyone give me an example? Like, can be some features which will point this more towards amoebic liver abscess and not pyogenic liver abscess.
Systemic signs will be more in.
I know that, but only radiology I'm asking.
Clustered abscesses will be there in pyogenic abscess. There will be in peripheral ring enhancement will be there.
Yeah.
But in amoebic liver abscess, that segment 7 alone will be characteristically involved.
Exactly. Bare area of the liver is the most common site for amoebic liver abscess. And like I told, there will be proper peripheral enhancement in pyogenic liver abscess. So this is going to be the connecting link between these three were parasitic infestations. So Dr. Sayantan, again, you didn't answer anything for this round. So you're going to get nothing, no minus, no positive. So the next question will go to Dr. Srinanda. Are you ready, Dr. Srinanda? Yeah.
Yes, sir.
30 seconds on the clock, okay? Yeah.
So, von Hippel-Lindau syndrome.
Okay, so you want me to take this answer?
So the first is probably pheochromocytoma, the second is cerebellar hemangioblastoma, and the third is renal cell carcinoma.
Wonderful. So third one is bilateral renal cell carcinoma. So this will be our von Hippel-Lindau syndrome. So this I think is very important for our exam as well as our day-to-day life. So it has the same mnemonic Hippel. So H will be hemangioblastomas. It will be mainly in the cerebellum and retina also. Retina, it's mainly angioblastomas. So retinal angioblastomas and cerebellar hemangiomas. Then eye is increased risk of renal cancer. Most common in von Hippel-Lindau syndrome will be clear cell carcinoma. And pheochromocytomas and pancreatic and liver cysts. P and L are pancreatic and liver cysts. E is again, like I told you, retinal hemangiomas. So Dr. Srinanda, you will get a positive of 10 points for this. So the next question, Mr. Karthikeyan, are you ready for your next question?
I think it should be to
Akshay.
Akshay.
No, sir, I jumbled this round up, sir.
Okay,
Based on scores, I jumbled the round up. So, Mr. Karthikeyan, are you ready for your question?
Yes, sir.
Okay. So, 30 seconds on the clock, it starts.
This is first one is periventricular calcification.
No, I don't want individual. I just need a connecting link. You have 15 seconds. Give me a connecting link between all three.
So if I answer this question wrong, I'll get -5, right?
Yeah. Actually, your time is up, but immediately
okay,
if you answer, I'll give you a chance.
Yeah, this is this toxoplasma.
No, that is wrong. Okay, so Karthikeyan, toxoplasma is there in the photos, but it is wrong.
There is toxoplasma in the B1. Yes, periventricular calcium. Those are torch infections, basically. I was explaining one of them. Cytomegalovirus is there. Toxoplasma is there. Herpes simplex is there. Temporal lobe encephalitis.
Yeah, see, so basically, Karthikeyan, I had given you more than 30 seconds and gave you one chance to answer. You told me.
I was like explaining each one of them because I was not like exactly sure everything was there.
Yeah, clearly I told a rule that within 30 seconds, I want a connecting link between these three. I didn't want the individual ones. So I'll have to give you a -5. I'm sorry for that. So can you, okay, like you already told, can you please explain all the photos, all the radiological image ones? Why did you
second image is toxoplasmosis. Those are those single lesions that are seen.
Okay.
First one is periventricular calcifications. So cytomegalovirus could be there.
Okay.
And the last one is temporal lobe is involved. So probably herpes simplex.
Yeah, very nice. So I have one question, Dr. Kriti Priya. So our Mr. Karthikeyan correctly guessed that the second radiological image was toxoplasmosis. Dr. Kriti Priya, can you tell me even neurocystic sarcosis has ring enhancing lesion? This is very important, so I thought I'll share it. Can you please tell me how to differentiate radiologically difference between neurocystic sarcosis and toxoplasmosis? Both will have ring enhancing lesions, right? Can you please tell me how do you differentiate?
Sir, in neurocysticercosis, the scolex is seen, sir, in
Okay.
between the rim enhancing lesion.
Okay.
And the lesions are revolving, sir, some in
No,
neurocystis.
I know that's all right. My question is, if you have one photo on the left, one photo on the right, both will have ring enhancing lesions. If you have to differentiate between these two, CT wise, how will you differentiate? Forget the clinical features, forget evolving. Both have two photos with ring enhancing lesion. One is neurocysticercosis, one is toxoplasmosis. Anyone can give it a try. No one?
I think NCC is multifocal and like it will be many will be there in NCC, but toxoplasma only single one will be there.
Sir, NCC there might be a scolex that is seen inside eccentric.
See, scolex, yeah, I understand, but it's very difficult to tell it's scolex on CT. It look the same actually. The only difference, very, very important difference, I think we all should know is that both are ring enhancing lesions, but neurocysticercosis is with contrast and toxoplasmosis is non-contrast enhancing lesion. So contrast enhancing lesion will be neurocysticercosis. Toxoplasmosis is non-contrast enhancing lesion. Like you guys told, it's again because of the scolex itself. So here in toxoplasmosis, it will be the calcification which is enhancing. So it will happen in non-contrast lesion. But in neurocysticercosis, the scolex or the inside parasite is what will get enhanced. So it is in contrast which will enhance it. So I think it was important. So I just put it up. So the last question, I think Dr. Akshay is left out.
Yes,
Akshay,
sir.
are you ready for this?
Yes, sir.
Yeah, the question goes like this, okay? I need a specific, I'll tell you again, I need a specific connecting link. Like I don't want a gross connecting link. I want a specific connecting link. You have 15 seconds on the clock. It will be negative if you give me a gross connecting link. I need a very
Sir, will you
specific.
specify if it is if you need a more specific answer? If I tell
Yeah,
something.
I'm telling you, I need a specific answer for this.
No. If I tell something, if it might be correct. So will you tell me if it is more specific, or should I?
No. I want you to give me the specific answer. I'll give you last 5 seconds because you asked a doubt.
Cyanotic heart diseases.
Yeah, awesome. So you get a positive of 10 points for this. So would you want to tell me what all are these three things?
Sir, first one is boot-shaped heart, tetralogy of Fallot.
Okay.
And second one is it looks like transposition of great arteries, Egon string.
Then what is?
Sorry. That is second one is Epstein's anomaly, box-shaped.
Okay.
Third one is Egon string TGA.
Yeah. See, I know your confusion. I put this specifically because even I used to get confused how to differentiate between TGA and Epstein anomaly. Sometimes box or shape part also looks like Egon string appearance. So one simple trick you can use is look for lung hypoplasia or hyperplasia. In Epstein anomaly, it will usually be lung hypoplasia, and transmission of great arteries will have lung hyperplasia. You can see hyperplasia of so this thing, more arteries are seen. So in lung here, there is no arteries seen. So by like that you
Not
can
hypoplasia
not
or hyperplasia, hyperlucency or
hyperlucency.
oligemia or
yeah,
is called oligemia.
hyperemia or oligemia. Thank you, sir. Thank you. Sorry, it was a mistake. Yeah. Thank
My
you, Kishan,
favorite congenital heart diseases.
Yes, sir. So oligemia and hyperemia. So usually this also looks sometimes like Egon string only. So you can look at hyperemia or oligemia and come to it. So you'll get a positive of 10 points, Dr. Akshay. So at the end of our third round, so the scores will be Karthikeyan, you will have a score of 25 points. Dr. Sayani will have a score of 15 points. Dr. Sayanthan will have a score of 40 points. Dr. Srinanda will have a score of 40 points. And Dr. Akshay will have a score of 35 points. So we'll move to our last round of today. And the last round will be our rapid fire round. So this will be the classification. I thought I'll put, because we are running out of time, I think this will be in all textbooks. I think this is one of the most important to know, which is cyanotic, acyanotic, and to identify the radiological images, both for our exams as well as clinically. So we'll move to round 4. So each question carries So this will be your redeeming round. So I'll give you for each answer. I'll give you 10 points. So you can. There's no negative. So you can take your chances. So you'll get just 30 seconds on the clock, and I'll see who answers the most. Just a second. So I'll just open the clock.
Sir, how many questions will be there, sir?
No, you can answer as many questions as you like to in 30 seconds.
So will all the questions be displayed at once, or
I'm going to read the questions.
Okay, okay, sir.
Okay, so I'm going to read the questions and I want the answers. So there are no negatives, so you can take your chance. Okay. So let's start with Dr. Sayani. Dr. Sayani, are you ready?
Yes, sir.
So you'll have 30 seconds on the clock, and good luck. I mean, all the best for your this thing. So this could be a redeeming round. So each question will give you a score of 10 points. Okay, ready?
Yes, sir.
Okay. So the questions goes like this. Empty thecal sign is seen in.
Arachnoid cyst.
Okay. Lung carcinoma staged using MRI.
Lung carcinoma.
Staged
What?
using MRI.
Next.
Contrast used in ultrasound.
Sonoview.
One disease with ground glass appearance.
COVID-19.
Investigation of choice for uterine pathologies.
Gold standard MRI and HSG.
So I'm going to consider that as the right answer. So you got 3 answers right. So you're going to get a score of 30 points in this round. So we'll go to our next contestant. Mr. Karthikeyan, are you ready?
Yeah, okay.
Okay. So here's your, the question starts now. The time starts now. Water view is used for what? Which sinuses?
The maxillary sinus.
Okay. Piezoelectric crystals is used in?
Paramagnetic in posterior pituitary.
Okay. BIRADS, what is BIRADS?
BIRADS is breast imaging for assessing the
No,
radiologist will send it to breast for breast cancer.
Full form of BIRADS.
Breast imaging, I'll go for next question. It's too big.
Okay. Curly B lines is seen in which pathology?
Pulmonary edema.
Okay. Pontine hot cross bun sign is seen in?
MSA.
Okay.
Parkinson's syndromes.
Yeah. Last question. Routine mammography is done after what age?
For screening, it is done after 35 years. And normally after 40 years. In high-risk people, about 25.
Just needed 40 years, but I will give you that answer. So guys, just stick to the point. Just stick to the answer question asked. So I don't need a gold standard investigation choice. No, whatever is asked, just tell me what it is directly. Okay, so I'll give you 3 questions, 3 answers for this. So Dr. Srinanda, are you ready for your round?
Yes, sir.
Okay, so your time starts now. Best investigation for minimal ascites.
Sir,
you can pass if you don't know.
CT scan.
Wrong answer. Regular sign is
Sorry, pneumoperitoneum.
Okay, Herbenden nodes is seen in which joint?
The next question.
Okay, father of radiology.
Roentgen.
Okay.
William Roentgen.
Yeah, your time is up, Dr. Srinanda. So you got 2 answers correct within the given time span. So you get 20 points for this. So we have a last but one participant, Mr. Karthikeyan. Are you ready for your round?
I think I'm done with mine.
Karthikeyan.
Karthikeyan is done.
No, Karthikeyan is not. Sorry, Sayantan. Okay, Sayantan, you're not done.
3 and I think 3 and 5 was left.
Yeah.
Sayantan, are you ready? Dr.
Yes.
Sayantan. Yeah, sorry. Yeah. So, Dr. Sayantan, so your time starts now. Contrast used for MRI?
Iodinated contrast. ROXL like.
No, wrong answer. Garby classification is used for.
What?
Garby classification is used for.
Pass.
Pseudo kidney sign is seen in.
Pass.
Investigation of choice for gallstones pathologies.
USG.
Water lily sign is seen in.
Adult cyst.
Dawson finger sign is seen in.
Multiple sclerosis.
Name one positively charged radiation.
Alpha death.
Okay, you got 3 answers correct, Dr. Sayanthan. So your total score will. So we have our last participant for today, Dr. Akshay. Are you ready?
Yes, sir. I'm here.
Okay. So your time starts now, Dr. Akshay. Cotton wool spots on skull is seen in.
Paget's disease.
Air crescent sign on chest CT is seen in.
I pass.
Subependymal nodules is seen in.
Tuberous sclerosis.
Best investigation for minimal ascites.
Pass.
One disease with ground glass appearance other than COVID-19.
Yeah, pass.
Dural tail sign is seen in which tumor?
Meningioma.
Last question. Routine mammography for is done at what age in a breast implant patient?
Breast implant at the age of 35.
Okay. So I'll give you 2 answers correct for your round. So by this,
Sir, 2 answers. One is cottonwood spots, sir.
Yeah. I'm giving you 2.
Dural tail sign, and
sorry, 3. Yeah, my bad. 3. Yeah. So all the rounds are done by now. So I will give me a minute while I do the final scoring.
Excellent. Meanwhile, I would like to ask our Shiva. Yes.
So that was an exciting quiz.
Absolutely. Absolutely. I big round of applause to the quiz master and all the finalists. Okay, it was one of the most exciting quiz I ever seen or ever witnessed. Tejas, very well done, my boy.
Thank you, sir.
And all the participants were equally competitive and they did really well. It was much better than even a PG quiz for that matter. These UGs are much better than even a radiology PGs for that matter, not an exaggeration. Everyone done well. Shiva, over to you. Please ask for their prelims and mains feedbacks.
Yes, sir. So before we go to their feedback, I want to personally thank Dr. You have summarized entire radiology in the past 1 hour. I realized, because I've recently written it, I realized entire radiology I've covered so superbly, and we can bet 1 year from now when next exam is happening, we can compare the radiology questions of next exam to the questions you have given today. It was so clinical and it was so repetitive in important points, and your explanations, it was too good. And the participants, again, a big round of applause for matching his efforts. The effort he put into the quiz was justified by your knowledge levels and your understanding levels. So overall, it was such a good experience. And my uncle, who is already a consultant in Manipal hospitals, he sat down with me till 3rd round. He was hooked. He had to leave for a job. He told, this is so good. I miss my UG days. So he was hooked to the type way you conducted this quiz. And cheers to everyone. So we'll go for the feedback from the participants for the prelims and for the finals. So first we'll start with the first finalist, Mr. Karthikeyan. What did you think about?
Yeah, overall it was a very nice experience. Actually, it covered almost all the basics and good rush through of all, especially the prelims was very nice. It covered OG, surgery, medicine, PH. Like it was quite integrated the way it was asked. So it was as a final year student, it was a good jog down the memory. As I went through the postings, it was a nice recollection for whatever happened through these posting days.
Yes, that's true. That was multi-centric, like all the 4 years summarized in all the questions. So that was really good. So next, what did you think about finals, Dr. Karthikeyan? How was the finals?
Yes, the finals was also very nice. I would actually love to have a very mega quiz from the side of White Army. Like 1 hour quizzes are actually is not even 3 or 4 hour quizzes can give us even more knowledge. That is my opinion. It was actually a very nice quiz as usual.
Yeah, your suggestion will be well considered. Okay. for next time.
Dr. Sayani, what did you think about today? Dr. Sayani, can you hear me?
Dr. Shani,
Hello, sir.
কেমন আছিল? Quizটা.
খুব ভালো ছিল।
খুব ভালো. The prelims questions.
Sir, the prelims questions, each and every question was challenging. There were some basic questions too, but there were some questions integrating medicine, surgery. So it was like ekdam next oriented. So it was very nice. The prelims
Out of 10, how much you would rate?
Out of 10, 9.9.
Oh my, why that 0.1? Second place, that's why. Okay, the finals.
The final, it was entirely learning experience. Each and every round was different. Means it was not like that each and every round was same and we could answer. Like each and every round was a different kind of learning experience, and we also had fun. Means I personally loved each and every round, and even, not only for my question, what the other participants answered, how they answered, and how Tejas sir explained after answering, and he also added some extra points that this is important for us, this is more important.
Each question he made sure that we take home
we learned something. Yes, sir.
Perfect.
Thank you so much, sir. I really loved the quiz.
Thank you.
Next, Srinanda.
First, I would like to apologize. I didn't know that there was a typo. So, Dr. Srinanda, over to you again.
Sir, it was a wonderful quiz, both the prelims and the finals. It was so clinically oriented that it was very interesting to solve all the questions, because other subjects were also getting revised. Along with radiology, there was revision of the other subjects. So I enjoyed the quiz.
Nice. Shayantan?
The prelims round was very good. The time limit and in that very good oriented clinical questions was very challenging, and finals were excellent. The varied set of questions with the excellent explanations. Enjoyed a lot.
Shayantan, time limit of that for 30 questions, 15 minutes, is it right enough, or you wanted more? What do you felt?
No, it was okay. We have to solve questions, think also, and take less time also. It was okay.
You people attempted the other quiz also today, the clinical quiz, what we conducted today? The afternoon, we had another quiz. Did not attend?
Yes, sir, I attended.
Okay, next, Akshay.
Yes, sir. It was very well conducted, sir. And first of all, I would like to apologize because my internet connection was not good. I'm at a periphery and I had duty, so the mobile data was not good. So I couldn't stay properly on call. And it was very well conducted. And first of all, I have made up my mind to take up radiology. So the love for radiology was always there. And other than that, it was very well conducted. Thank you.
Dr. Kriti Priya. You're muted.
Sir, it was very nice, sir. The prelims, it had touched all the parts of medicine, surgery, and it included all systems, sir. Even the finals, like no system was left over, sir. GIT, renal, CVS, CNS, everything. It was very nice, sir. And the explanations, of course, whatever sir had explained, it was it was a wholesome learning experience.
Correct. So questions were.
Hello, sir. Sir, one more.
I always wondered. Okay, the present UGs from our batches, the current U people are much better. Okay, the way you interpret the radiological images, or the way you think, the way approach, everything's totally different, and you are far better than all the previous batches, and you people are doing really great. The way Karthika, and even before the question was put, he used to answer the fourth year MBBS student. We cannot, okay, others are interns, they might have seen in the postings, okay, but a fourth year MBBS student answering like that, we can't even imagine. Okay, excellent. You people are working really hard and doing your best. I'm really happy for all of you. All of you done really well, especially that MRI and CT. They're not very easy. The questions were, I feel it was of moderate range, not very easy or not very tough. That were most of them were moderate range, and especially that connecting where if you know the things entirely, only then you can answer. So such kind of questions were framed. Very well done, Tejas. I should really appreciate you. I have seen so many quizzes. I have been conducting since so many years now. I have done so many quizzes, but this is one of the exceptional one. Okay, very well done.
Thank you, sir.
Shiva?
Reputation with pathology quiz, and he just hit a double century. He exceeded his own expectations and own reputation. And
Yes.
I'm going to share this quiz from YouTube to a lot of my classmates and my students. Worth watching. The entire 1 hour was so fun. So amazing. Thank you to Dr. Tejas. Thank you.
And yeah, the best thing about his quizzes are like he makes sure that all the other options are also like explained well, and the entire topic is covered like as a whole. So very nice way. So can we have the final results, Dr. Tejas?
Yes, sir.
Just for their assessment, it's for just self-assessment. It's not like I have already declared the results in the groups that all the finalists are winners, and I already congratulated all of them, because we had more than like 600 or 700 participants in the preliminary round. And in that particular time, but even it will continue. They keep on attempting the quizzes. In that time, you are the best among entire Indian students. You 5 or 6 were the best. So that itself is the biggest credit for you people. And you can show, like you can know for yourself where you stand among others in the in the competition. So just to reassess yourself, we'll have the scores. Tejas, please.
Yes, sir. Now, before I announce the score, I just want to tell, like you told, here all of us are winners, sir, not just the participants. And here, everyone watching this quiz, including me, who conducted this, all are winners because we're all learning something and we're taking home something. So I think, yeah, radiology is one of those subjects. I think any branch, any clinical branch will need it. Like it's not just radiology people who need it. Every clinician needs radiology. So I learned a lot, and your responses were overwhelming. Thank you so much. It all was worth it to hear at the end of the day. So without further ado, I'll just announce the scores and ranks. So at 5th position, we have Dr. Sayani with a score of 45 points. So congratulations to Dr. Sayani. And yeah, so at 4th,
even pathology you had participated, no? In the finals, you were there, right?
She was there.
Yes.
Yeah, she had done well.
She is the only person to have repeated in both of my quizzes.
Correct.
Yes, sir. So at 4th position, we have Mr. Karthikeyan with a score of 55 points. Congratulations. And at 3rd position, we have Dr. Srinanda. First of all, I would like to apologize for the typo. I'm sorry for mispronouncing your name for so long. Thanks to Kishan sir, at least in the midway, he corrected me.
It's all right.
Yeah. So Dr. Srinanda has scored 60 points and she's at 3rd place. And 2nd place, we have Dr. Akshay. I think he's in the middle of his duty and he is still attended the quiz. So kudos to that. Congratulations to that, first of all.
Oh, he's one of very active members of White Army. Since maybe first year, second year MBBS, you're there, Akshay?
Since 2nd year, sir. I am like I huge. Like I recommend everyone. Like anyone who asks, first thing I was telling is White Army is one recommended YouTube channel that.
And he participates in almost all the quizzes and he does well. Okay, Akshay. Good.
Congratulations to that. And at 1st place, we have Dr. Sayanthan with a score of 70 points. So congratulations, Dr. Sayanthan. Sir, if you see only 5 points difference between all the participants. So it is 70, 65, 60, 55, 50 like that. So it was a very close call. And I was actually very astonished. Like Kishan sir told, you guys are way ahead of where we were.
Yeah, absolutely.
Like even just 2 years before where I was, I think you guys are much ahead and much clinically oriented. So congratulations to all of you, first of all. And thanks to Dr. Shiva Prasad for taking his time and hosting the quiz. And thank you for overwhelming appreciation. And biggest thanks to Dr. Kishan sir to have given me this opportunity.